Again, welcome everyone. This is Let's Talk Dental. We're about BioLay's webinar series. We're excited to welcome Tiffany Wuebben as our speaker. The lecture this evening is titled The Prophy to Perio Conversion, Strategies for Patient and Practice Success. In this lecture, Tiffany will provide key strategies to seamlessly convert patients from Prophy to Perio through clear education, calibrated care plans, and unified communication. We are hosting tonight's webinar on the Zoom platform and welcome your questions during the lecture in the Q&A feature in the lower toolbar of your screen. We will wrap up tonight's lecture and session with a few minutes to address audience questions with Tiffany, so feel free to post your questions during the lecture. At the conclusion of the lecture and Q&A, I'll provide information about BioLay's education CE process, along with additional web resources you can access to continue your learning journey in laser dentistry, including information about our next webinars. We have quite a few scheduled in October and November. Tonight's webinar, as always, is being recorded, and we post all of our recorded webinars in a library that you can find at education.biolays.com. As the founder and CEO of the Hygienepreneur, Tiffany Wuebben is a published author and speaker and is dedicated to serving the dental community in a big way. Tiffany's influence empowers the dental team to practice with an ownership attitude, which leads to better clinical outcomes, higher case acceptance, and more productivity for the practice. This solid base starts with mentorship, education, and training. Her book, Hygienepreneur, The Dental Hygienist's Guide to Achieving Career Success and Personal Transformation, outlines 25 key lessons for becoming the ultimate dental hygienist. One who provides the highest level of patient care, contributes significantly to practice revenue, and gains new insights into mastering their destiny. With 30 years of dental experience, Tiffany is vested in practice and patient success through the growth and support of a highly profitable hygiene department. She has a unique passion for the field of dentistry and believes in giving back to the profession that has given so much to her. Tiffany, so excited to have you join us this evening, and I will hand it over to you and let you take it away.
Well, thanks, Joe. And thank you, everybody, and welcome to the whole strategies on Prophy to Perio conversion. One of the hardest things that we have to do as providers. And, those new patients that come in, they've been seeing the same doctor for over 20 years, and now we've got him in our chair, and now we have to have that conversation, right? So I developed this course because so many of us have those struggles and having those courageous conversations with our patients, but there's a methodical approach to it. There's a way that we can convert patients seamlessly and they're bought into the care. And so we're going to go through those strategies this evening. And again, yes, my name is Tiffany Wuebben, and I'm very passionate about hygiene. I'm passionate about building hygiene departments that are thriving and the foundations of success for the dental practice. And so I am so excited about this. And so if we look at these two characters here, I don't know about all of you, but I did have a lemonade stand when I was young. And it was kind of interesting. Some days we would have great selling days, and then other days we would not do so good. And so I came across these two pictures, and it's a little boy, of course, who, has his lemonade stand and he's not having very many sales. And then this innovative little girl, her lemonade stand, she's crushing it because she said, I'm going to give away a free cookie with every single glass of lemonade. And she did really well. So the whole entire picture of this is, what if I could tell you that if you incorporated one idea, one fantastic idea to your hygiene department, and that it could act as the catalyst to spark a change on how you would approach care for all of your patients for life. So let's just think about that. So I'm going to talk to you about that big idea. So a lot of us dental providers kind of feel like this. We've got a lot of hats that we wear, and we have a lot of care that we can deliver utilizing different tools. And so we're going to expand on that big idea that surrounds adjunct therapies. And when we discovered as a hygiene team the power of adjunct therapies and the care that it could provide to our patients, a big thing happened to our hygiene department. The minute we got bought in to, yes, we would do scaling and root planning procedures. Yes, we would do perio maintenance and, provide the care, do the diagnostics right, take care of our perio assessments. But when we started honing in on the extra essentials to elevating patient care, hygiene department just boomed. Profitability just expanded, and patients were better served every single day. But having adjunct therapies, and that's the big idea, is leaning on adjuncts. What happens is the whole entire hygiene department hones in on the proper care for the patients and looks at care for the patients as what is the proper care for overall body health, not just our oral health, right? Our systemic health. We just know so much now. So we've got to deliver that extra care for our patients, knowing that the oral cavity is a direct link to everything else. So we're going to talk a lot about that this evening for sure. So our objectives are to identify the connection between delivering high quality perio care and department success, assess patient risk factors, tailor treatment plans for improved patient outcomes, and of course, increase revenue, and practice communication skills. So that way we can deliver that message and get the yes from the patient. But it's all about the care. The patient is served and is appreciative. The hygienists are satisfied both emotionally and financially because everybody's going to win if we're doing the hard work, right? And the practice is highly profitable and definitely thrives on the foundation of a very successful hygiene department. And of course, that makes our dentist very happy, which makes me so happy. It's a triple winning scenario. That's what we're going for. And so the importance of prioritizing proper periodontal care is that the patient is properly served, that we are providing comprehensive treatment plans. We're enhancing our treatment offerings by making sure that we are looking at the patient as in their overall wellness, not just their oral health, right? Because it's all connected. And we're strengthening those professional reputations because when we're out there doing the very best for our patients, well, the community, they know our reputation, it just follows us. And so it's just amazing to serve our patients in the best way. And then of course, in the end, when we do the proper care for our patients, we're going to have increased hygiene revenue, 100%. So this whole study, this whole entire information just astounds me. But according to the CDC, 50% of adults 30 years and older have some form of periodontal disease in their mouth. And 70% of adults 65 years and older are suffering from periodontal disease. So my question to you is, what's the percentage in your practice? And I hope that you're tracking that because I think all of us do. And if you're not tracking it or you don't know how, please reach out to me and I can help you with that. And that's just one of the things that we do with my company, the Hygienepreneur, is that we want to make sure that we're tracking those metrics because it equates to care. So this is wonderful if you can know that number. So if 70% of adult patients have perio disease, then why is the industry perio percentage rate at 18%? We're at 18% generally. When I was out there temping for a couple of years, getting all the content for my book when I was writing it, I was in over 100 practices as also working full time for my doctor. And I learned that we were really doing a lot of great things in our industry, but we were also sometimes missing in the mark in certain areas. And so it left me to question, gosh, we've got to really do more for our patients. We have to make sure that we're doing all the proper assessments and not skipping steps, and really elevating that care experience for our patients, and making sure that our patients are highly educated and in their oral health, and talk about risk factors with systemic health, and all of those things, and we'll drive that number up 100%. So, why is it 18%? Well, it's because we need improvement in diagnosis and management of gum disease. We're underdiagnosing it, meaning that it's either unnoticed or we're undertreating it. And there's lack of consistency. There's a variance in diagnosis criteria amongst providers. And that's why we talk a lot about calibration amongst providers in the practice, and how key that is for the success of the patient's oral health. And then some of us just assume that the patient can't afford it. And I learned back when I used to present big treatment plans before I became a hygienist, that we never led with that in analyzing patients' pocketbooks. We let them drive that because that's their business. We would just present the care that was needed, and then help the patient work through all the financial concerns and what have you, and get it set up for them, and just move forward, and really guide them through that care process. But if we're assuming that they can't afford it, then we're putting up a barrier where we don't need to. So, that's just one of the reasons why. But dentists and hygienists, definitely, I've seen this, don't discuss expectations and goals. And the dentists and hygienists don't talk about the practice mission statement. They don't establish the assessment protocol for the practice, the Perio protocol for the practice, and what are the adjunct therapy guidelines that the doctor and the hygiene team wants to push, as far as, okay, what else are we going to be doing for our patients? What are the real problems in our hygiene department? What are we seeing with our patients? And what are the adjuncts that will help elevate that patient's care? All of that usually has to be pre-discussed. And so usually it's not. So that's one reason why our perio percentages are low. And most dental providers don't want to present uncomfortable news. We don't want to rain on somebody's parade, especially when we've just met them 5 minutes ago, right? I always say that hygienists have the most beautiful gift of building great relationships with new patients in 5 minutes. We can build that trust and that bond and that likability very quickly. But a lot of us, it's hard. When we see an image and we see bone loss, 60% bone loss, we're seeing in the perio assessment bleeding and pus, and then we're going to have to deliver that news. And you know what? Sometimes it's been a very hard day, and sometimes the patient didn't have their paperwork filled out and the patient was seated late. I mean, these are the things that happen in dentistry. We all know that. And then we have to have that conversation, and we're just like, oh my gosh, we just don't have the time. Are they going to accept it? I just met them. So this is one of the reasons why also our perio percentages are so low. But we're going to go through all of these obstacles and show you exactly how to seamlessly guide that patient through, so that way they get the proper care that they deserve. So what is perio percentage rate? Well, it's the proportion of periodontal procedures in relation to the total number of hygiene procedures performed. So it's all of the codes, right, that we know: 4341, 4342, 4355, 4346, 6081, and 4910. And so what we do is, to calculate that, we take the total number of perio procedures over the total number of hygiene procedures, and we multiply it by 100, and that's how we get our perio percentage rate. Now, a lot of us have analytics software companies that come in and they help us, and we're able to see a hygiene scorecard. We're able to see our perio percentages and our acceptance rates, and our our reappointment rates with appointments, and how much root planning we're doing. And so if you all have that, it makes it so easy. And so then you're not having to do these calculations on your own. But I do encourage hygiene teams every time I'm working with a team to know their metrics so that way they know their care. And so if there is a analytics company that is helping with that in your practice, then I would definitely encourage letting your hygiene team know their metrics, show them how to work the software so that way they can really help manage what's happening in their operatories with their patients. So let's really make sense of all of these percentages and what's standard of care, what's above the standard of care, what's normal in our industry. So basically, if we're looking at a 20% perio percentage or lower, then we're definitely needing some improvement there. We're needing to sit down as a team with our doctor, go over the perio protocol, go over our assessment protocol, go over what our message is and what our mission is in that department and how do we really want to treat our patients. And so we've got to make sure we're practicing consistent calibration, maybe doing those case studies like we did in school. I mean, you all remember that. I do that a lot with my teams. When I first come in and I start helping with a practice, I'll bring in case studies and I'll say, okay, guys, there's no wrong answer. I just want to see if you're all on the same page. And so if they're not, then we have a discussion. And then a lot of times the doctors will periodically in their monthly meetings, they'll pull up images and go through it with our hygiene team to make sure that everybody's on the same page. And it's just a great exercise. And it makes sure that everyone's speaking the same language, no matter who sees that patient, that care plan that they're suggesting is going to be the same, and that we're following what the doctor wants for sure. So if our percentage is 35 to 45%, well, we're doing pretty good. And we've got a medium size share of nachos, right? So it's so good when we can see that number. That means our patients are properly being cared for. We're following through with our assessment protocol. We're all pretty calibrated. We're having those conversations. We're educating our patients and we're also making sure that the patient absolutely understands the connection between oral health and overall systemic health. And when we lead with that, we're going to do really well with that conversation with our patient because everybody's ears now are perked up about how their systemic health is and how it relates to the oral health and how oral health and systemic health, it's a bi-directional relationship and how it's just all so important to have those conversations. So definitely we need to continue to review our programs with each other in those team meetings, enhance our communication skills, and increase continuing ed. That's for sure. Now, if we're 50% or above, we're crushing it. I mean, we're doing everything that we need to do. And so definitely I say just keep maintaining those good CEs, go out there and keep yourself fed and engaged and networking with like-minded professionals and stay motivated. Just continue to stay motivated because we're fighting disease every day, right? I mean, this is not going away. So just keep up the excellent work. Now, a lot of these percentages, as a side note, it depends on your practice demographics. If you have an older practice demographic, you have patients in your practice that are a little older, then of course your numbers are going to be higher. But if you have a practice with a younger demographic, then we're going to see those numbers be a little bit less. And so when we go into a practice, we will let the practice know exactly. We'll tell the doctor, okay, this is where you're probably supposed to be based upon your community, your patient community, and then of course, then we can establish a baseline and grow from there for sure. So what does it mean to be hygiene driven? I mean, this is something that I talk about all the time. And at least twice a week, somebody's emailing me saying, Tiffany, what does it mean to be hygiene driven? Well, it means all eyes on hygiene. Everything's about hygiene. I firmly believe that if we focus on the hygiene department and we nurture it and we elevate it and we do everything we can to educate our hygienists uplift them and make sure that they have all the tools to succeed, that thriving hygiene department will grow a practice to new heights, all with the power of hygiene. So when you're hygiene driven, it's all eyes on hygiene. Everything's being nurtured. The hygiene department is being nurtured in a big way. And then what happens is the overall results of the practice are just amazing. So, and this is my mantra. And when we go through and we're working with practices, this is how we lead and this is how we get our results. And it's just fantastic. It's fantastic to deliver exceptional care, next level care, and at the same time be able to run a very nice business, a profitable department, and see a really great profiting dental practice, all because hygiene is driving it to new heights. So it's just exciting. So the real commitment is in conversion, right? So it's always about, okay, we got to commit to convert. We've got to commit to do no more bloody prophies. We've all heard that term through the years. And we've got to definitely lead this step forward by empowering our hygienist, giving them the reins and giving them the keys to the kingdom and say, okay, let's drive this. Let's do this with the power of hygiene, and forming those strategic alignments and partnerships with our doctor, mastering the perfect assessment process, practicing communication techniques to educate our patients in a big way. We want to make sure that they're fully educated about their health. And hygienists, know your dental business. The hygienepreneur was built on an entrepreneurial mindset, a growth mindset. And so we are always going out and just locking arm in arms with our hygienists and saying, guys, you can drive it. You can be in charge of everything that's going on in your operatory. Actually, you are in charge of everything that's going on in your operatory. That is your business within the business. So of course you want to know your business. You want to know what's happening in your operatory, in your little department, and what's going on. And so knowledge is power. And so we're going to talk more about that too. So the 4 ingredients to boost perio conversions, here they are. Dentists and hygienists collaborate on the perio protocol and the adjunct therapy protocol in advance. Perform the perfect assessment. We're communicating that. We're educating our patients and definitely building our case. It's all about building our case, and we're gonna share more about that too. Presenting our assessments with the right phrasing to get the yes, because isn't that the goal? To get that yes, and to do our perfect hygienist to front office handoff. We're going to do a hygiene to doctor handoff, which is excellent. And I'll share the steps in that. But the handoff, that gift of the handoff between team members, it's not just for us to hear it, it's for our patients to hear the information. And then, of course, it helps promote good communication and there's clarity there. And it streamlines the process and helps really with time management, because if we can do a handoff, that reduces a lot of the extra words that we have to use. And front office isn't having to run to the back to ask additional questions because the handoff was done excellent. And so that is usually practiced and everybody is doing those steps and it's just wonderful. So again, no more bloody prophies ever again. After these 4 steps, that's what we're going to go for. So let's go into step 1. Dentists, hygienists collaborate on the perio protocol and adjunct service offerings. And so it's all about creating the perio protocol based upon the dentist philosophy, writing it down and practicing it and talking about it, and following through with that same plan every single time as a team. So everybody's doing the same care plan based upon what they're seeing. Everybody's in agreement. And the key for great patient care is provider collaboration or calibration and collaboration. So these team meetings, these hygiene meetings that we always schedule once a month, and this is a tip, once a month for an hour, doctor and hygienist get together and talk about this. Talk about the assessment process, perio protocol, the adjunct therapies, whatever you're seeing in your department, you're like, oh my gosh, this is what's going on. And we need an adjunct to help with that. Fluoride, these are just the examples, and we're going to go through more later. But when we have those meetings, what happens is it's an open communication back and forth. The hygiene team will say, this is what I'm seeing. This is what we're needing. The doctor is saying, okay, let's move forward with that. Let's just take care of these patients. And then what's happening is that great collaboration partnership between doctor and hygiene team is happening. And that just makes everybody feel that much better and secure and, better communicating and all of that. So that's the first thing. A lot of practices don't even have meetings where the doctor and the hygiene team meet. Maybe they'll have an overall practice meeting, but not between doctor and hygiene. And so I found if that happens, it's amazing the growth that can happen. And so a lot of times we will definitely help facilitate those meetings, even writing up the agendas for the doctors, so that way they know where they're heading when they go into these meetings. And a lot of times we'll have one hygienist who kind of leads it, and it's just wonderful, that whole collaboration as everybody gets calibrated. So we need to establish our assessment protocol, perio protocol, and adjunct service offerings in those meetings, and then revisit those once a month, definitely. So again, it prevents miscommunication and reduces provider stress. It leads to purposeful patient communication that promotes lasting relationships, which isn't that what we really want? We want to gain the patient for life. And so that's what this does. And it's just great when we can all be on the same page and the patient doesn't see confusion. They don't feel confused because everyone is speaking that same language. It gives the provider stability to deliver the great patient care with repeatable systems. It's just like an athlete going up and one of these MLB big league hitters. They go through all of this training and they do the same thing all the time. And then what happens is muscle memory kicks in. They don't even need to think. All they need to do is get up there, get in their mindset, and hit the ball. And so it's the same thing when we develop great operations in the hygiene department that are repeatable, that are scalable, that we train on. And what happens is the team adopts it, they adopt those practices, and then it becomes seamless where we're not even thinking, we're just doing. Even down to our language. Like, I know when I practice, I knew at 7 minutes after the hour, and all my team did too. They knew, and I knew exactly where I was going to be with that patient in that process of care. I was that systematic in the way that I approached every appointment. And even though they were all different appointments, every single appointment had the same method of operation. I never deviated, and my language was always the same. And so what happened was when the patient would come in, they say, "Oh, you're going to do that, right?" They were bought into my process because they knew my process. After 11 years of seeing somebody every 3 months, they knew my process, right? And that showed how thorough I was. So our hygiene teams, we encourage those repeatable steps, and making sure that everybody's speaking the same language, that we're doing the same assessment process. And that way it doesn't matter if that patient sees Mary on a Tuesday and then Mary's gone on vacation in 3 months and now Sheila's stepping in. Well, Sheila's going to pick up exactly where Mary left off. And so that's super key, especially when you have a practice that has 2 hygienists or 9 hygienists. Like, we have some practices that we manage that have 9 hygienists in the practice. So if you can imagine, calibration is absolutely crucial in a setting like that too, right? So let's go ahead and talk about being calibrated with the Perio protocol. And it all starts with our hygiene department mission statement. It goes back to when I used to work at the Ritz-Carlton, and we had a mission statement. We were ladies and gentlemen serving ladies and gentlemen. And We had a little card that was part of our uniform that was in our pocket, and it had our values and it had our promise to serve. And so when we come into a practice and we start to help with training the hygiene team and really helping to create a thriving hygiene department in that dental practice, we will start with getting the team and the doctor to write the hygiene department mission statement first. It puts us all on the same page as far as what are our values, what do we want to see for our patients, what are our goals, and so we start with that. And it's just an amazing exercise when we all can do it together. And then when it's written as a team, we post it so patients can see how we value hygiene and how the practice elevates hygiene in a big way. And then in turn, the patient will. The patient will see the hygiene department as something very, very special and, just really elevate their care. They'll go, gosh, the care in this practice is so elevated. Of course, I want to be on board with that. So it's a mindset. So it starts with the mission statement, but it's also about what are the problems that you're seeing with your patients. These are the things that you're going to talk about in your hygiene and doctor meetings. What is your dentist periodontal protocol? Even if you're a guest hygienist, and you have, like, if your practice is out there that have temporary hygienists, guest hygienists coming into your practice, I definitely recommend having your perio protocol and your assessment protocol already written up and then handing it to them so they know what your expectations are. And they'll appreciate that. I know when I temped in those over 100 practices, twice that happened. And I was like, whoa, this practice is next level because they cared enough to write it. They cared enough to create a system around it. And they cared enough to give it to me as a guest hygienist because they care about their patients in their care and what I would be doing for them that day. So leading like that is a huge plus. Of course, I had other practices said, don't even worry about peri-charting today. We know you're a temp. And I was like, no, of course I'm going to perio chart because it didn't matter if I was a guest hygienist in that practice or if I was a hygienist that had been working with my doctor for over 11 years. When that patient is in my chair, that's my patient. It's my job to make sure I was doing everything the right way for that patient and that they were served in the right way. So then the last thing to discuss amongst yourselves is what is your dentist adjunct therapy protocol? And that's very important. That is very important. When we start to see these adjuncts, the adjuncts become the next level of care. And it really does shine a light on the perio part of our hygiene department and that we've got to do more.
So here's the adjuncts, okay? This is what boosts the hygiene department. Yes, we've got to do the care. We've got to do the scaling and root planing, the perio maintenance, all of those things. We've got to make sure we're reestablishing perio every 2 to 3 years with our perio maintenance patients by doing those site-specific scaling and root planing procedures. But our adjuncts, this takes our care to a whole other level. So we've got fluoride, sealant, antibiotic therapy, laser therapy, and sealants for adults and children, curodont, silver diamide, gosh, even whitening, right? We hygienists can do all of the things, all of the tools. And so thank goodness we've had the Epic Hygiene Laser that was made by hygienists for hygienists. And look at all the things that we can do with that laser. We can reduce inflammation by doing LBR, laser bacteria reduction. We can do a laser-assisted periodontal therapy. We can initiate the tip and remove diseased tissue by doing inadvertent curettage. We can treat aphthous ulcers and herpetic lesions and have hemostasis happen. I mean, it's just reducing that bacterial load. That's what helps us with our systemic health. I mean, the inflammation in the body, we just have to make sure we're reducing inflammation, and it starts with the oral cavity. And of course, treating teeth that are sensitive. We can do that with the laser too. And so biostimulation is going to happen, succular debridement, antimicrobial effect. These gram-negative bacteria, they are strong and they are fighting to spread disease in our mouth and the rest of our body. And so we've got to use the laser to help combat that. And that's what it's doing. And it's easy to use. It's easy to train. You know, our hygiene team, we do that a lot. We'll go in and we'll help integrate lasers into the practice, and even down to the communication and the verbiage and how to present that to patients. And it's a practice builder. It increases care and profitability, and it's so easy to use, and it reduces pain for the patients. And, you know, it just really enhances those patient outcomes. So the Epic X also increases care and profitability. A lot of our doctors will use the Epic X because it can do so much. I mean, look at all the procedures it can do. It can do crown lengthening, endo, TMJ pain, photobiomodulation with that special attachment here. We can perform frenectomies and implant recovery, perio pocketing, of course. And it's all done seamlessly, less invasive. I mean, that is the goal. Anytime any of our patients are having a procedure, we want it to be less invasive. And with the laser, we can experience that. And of course, it's more efficient. We've got better outcomes with laser therapy, and it's fast, it's easy. A lot of hygienists will say, hey, how long does it take for you to disinfect the whole entire mouth with a laser? Well, it's like less than 5 minutes. So we really don't have to add extra time to our procedure. We just have to go in and really focus on good time management and have that, you know, that communication with our patient, deliver that message in a really nice, tight approach, and deliver the care. And we can do that most definitely. And that takes an unprofitable hour of hygiene into a profitable hour of hygiene, like that. So we are healthcare providers in the dental field. That's what we are. And I know that all of you probably believe that you're not just a dental provider. That's not it. You are a healthcare provider. And so a lot of you have gone above and beyond and really helped to treat patients and see that, hey, there's something else going on here, like diabetes. I mean, we've had that where patients aren't healing, or we're just seeing it just doesn't look right. And we encourage them to go see their doctor to have tests done. Or we perform our oral cancer screenings, and guess what? We're finding oral cancer. So we help prevent systemic disease, we reduce oral inflammation, and we reduce systemic inflammation, most definitely. So we've got to perform the perfect perio assessment, communicate, educate, and build our case. So after our 5-star greeting and medical health update, we're going to ask permission to complete the planned care. And so, of course, the patient's going to say yes, but we want to get them bought in as partners in the care plan. And we're going to communicate as we take the images. We're going to educate as we're doing our assessments. So that helps with our time management, most definitely. So it's a lot of show and tell. And if any of you have AI imaging in your practice, it really does help with show and tell too. But if you don't, it's bringing those images up, showing the perio assessment, showing the bleeding points, and really having the patient be a partner in the care plan that you're wanting to offer. So, you know, we've got to make sure we're doing our perfect assessment, perio charting every single time, making sure that we're not just doing our perio numbers, our perio charting, but also furcation involvement, our bleeding points, our mobility. All of those things need to go in there, right? And we've got to make sure that we're doing all of that every single time. So that way the message is being heard from the patient every time. And then we're going to seat the patient up, and eye to eye, knee to knee, heart to heart. We're going to have those conversations with the patients. And because we took the time to educate, they're going to say yes to us, and they're going to better understand what we're talking about. and that we're there as their advocate. We're there as partners in their care plan. And definitely saying, hey, we're going to present this to the doctor and let the two of you talk. And hygienist, I'm going to do whatever the both of you decide. Most definitely. So it just shows that we're just very caring, and that we're there as a guide, and we're there for them for life. And so, then when the doctor comes in, we're going to be able to do that handoff to them seamlessly. And so it's where the hygienist speaks and the dentist definitely listens, right? This streamlines that exam time, by the way. So we're going to present the patient by their first name because we know that elevates them as people in the practice. That makes them feel very good when you call them by their first name. And the doctor can sit and nod and say, that's so nice, but we want he or her very quiet while we deliver that handoff information. We're going to give the overall medical health. We're going to let them know what you and the patient saw on the x-rays and on the perio assessment. You're going to tell the doctor what the patient is concerned about, because remember, we're listening to our patient's concerns, and we're going to let the doctor know what concerned us. And then we're going to turn to the patient and say, have I covered everything? And the patient is going to be wowed because we did. They were heard. We're seamless in our approach. And now the doctor can take over the next part. So now the doctor speaks and you listen. The doctor is going to ask permission to lay the patient back. May I go ahead and start your exam, take a full tour of the mouth. And then as the doctor is gathering all the restorative and all of the information and really talking about the restorative needs and the surgical needs, you're getting all that in the computer, of course. And you're doing the nod, which is affirming to doctor and the patient that you are bought in with that and you agree with the doctor's approach. Because at the end of the day, when doctor leaves, what happens? They always turn to the hygienist and say, do I really need that? So we want to make sure that we're nodding in positivity and that is a great plan. And that we're basically always making sure that we're listening to the doctor so we get all the plan in there and it's clear. And also thanking the doctor for reconfirming the oral cancer screen, which elevates the value of the exam. A lot of patients still don't know that we do oral cancer screenings during our exams. And really making sure that we have all that information, because doctor's going to hand it off to us and then we're going to sum it up and of course take it to our front office and do the final phase of this, right? So confirming the recommendations for hygiene, doctor's going to do that too. And that elevates that hygiene care plan. The doctor's going to say, I would definitely recommend doing this, this, and this. And yes, whatever you and Tiffany decided, please go ahead and run with that, because I did see the bleeding in there and we've got to make sure that we get that properly maintained. And so when doctor is saying the same thing that we are, then that elevates the care plan and the patient is even that much more bought in. And even down to the adjuncts. The doctors need to say yes, and please treat that area with the laser, or please treat that area with that fluoride varnish. I'm concerned about that root. And so it really helps the patient hear and see that everybody's on the same page in agreement, and then the patient gets bought in with that too. And we've got to make sure we're involving the patient in that plan. That's the partnership. That's the beauty of partnership with our patients. And so we're going to go ahead and, of course, make our next hygiene appointment because we want a 97% reappointment rate. And we're going to go through the doctor and patient's plan, and then let the patient know that you're going to bring them up to the front and guide them with that, and let the front office know exactly what you and doctor discussed, right? And we're just going to definitely support the patient and the dentist by restating all the facts. So we're going to reserve the next appointment and explain and answer any questions, and definitely reappoint those patients ourselves. So that way we make sure patients show up for their hygiene department appointments because we made it. It's just like you know, our hairdressers or something like that. When we make it with our provider, we're more apt to show up. We're more apt to show up on time because we don't want to disappoint our hygienist. So definitely making sure that we're rescheduling those patients right away. We want to make sure our attrition levels are low and take charge of our schedule as hygienists. So conversion success, the final thing, front office preparedness, and they're going to be so prepared with the financials, with the treatment plan. We're going to do this beautiful handoff. We're going to guide the patient up to the front and say to the patient, you know, Sheila's got you in the front. She's going to go over everything for you. She understands your insurance, any financial concerns, because a lot of times the patients will ask us financials, right? And so the front office has already reviewed the treatment plan. They've got it organized and inputted, and they're ready to present the periodontal treatment plan, the restorative oral surgery, and we're going to strive for a 75% acceptance rate. And our front office is epic, right? So the handoff is going to sound a little like this. You're going to greet your scheduling coordinator by name, and you're going to let's say her name is Mary. You're going to say, Mary, Sheila and I had such a great visit today. And we did go ahead and do as scheduled. And we did schedule Sheila back for her next hygiene appointment, but we need your help. Doctor and Sheila have made a plan to go ahead and start on the upper right, and they're going to need about an hour and a half. And if you can take care of that, that'd be great. And Sheila does have questions regarding financials and her insurance. So, and I told her you were a pro and you would help her with that. So thank you so much for taking such great care of Sheila. Sheila, it was so nice seeing you. Have a fantastic day. And then we hygienists are going back to our operatory, but the handoff process is in basically 5 steps. So here's the first 3, and we're finalizing it by, you know, Sheila, Mary's got you. She's going to take great care of you. And so that baton is passed and everything gets scheduled, and you've scheduled that appointment back, periodontal, everything. And then the front office can handle all the restorative. And then that's how we get that 75% acceptance rate, is because from one provider to the next, we're speaking the same language and having that handoff from one to the next, saying the same thing, the same approach, with the same nod, the same affirmations, the same partnership with our patients and advocacy. And that's how it's done. And of course, we're going to have a triple winning scenario where the patient wins because they're getting such fantastic care. They feel good about themselves. They can eat the foods they want to eat. Their aesthetics look better because the gum health is better. The practice is going to soar because we know Perio is 6 to 9 times more profitable than a Prophy. And then, of course, professionally, hygienists, we're going to feel so good about what we're doing, that we're really doing the next level care and then some. So here's the QR code for my book. Feel free to download it. And if you aren't able to, reach out to me via email and I'll send it to you. But here's the QR code. Give it just a second. I also dropped a QR code in the chat before we started with all of the links to different things that we support hygiene teams and dental practices with. The first 2 chapters of my book are in there. My email address, if you're needing any type of extra support. I also have the scripting for laser therapy on communicating to our patients and the verbiage. So if anybody wants that, please email me. And of course, we want to thank BioLays for having us this evening and hosting this beautiful webinar. And they really are the leaders in dental lasers in every way, and just next level care times 10. And so thank you so much, BioLays. And so please, I'm offering to everybody who's on this webinar a free hygiene department analysis and strategy session. It's valued at $1,000. Please email me if you'd like to take advantage of this, and it'll revolutionize your hygiene department. Definitely, when we're building that hygiene department into success, we're going to reduce provider fatigue. That's number one, provider stress and fatigue. We're going to obtain a hygiene-driven practice. We're going to achieve successful patient outcomes, increase case acceptance, and boost productivity and profitability, and so much more. And so there's my email address if you all would like to take advantage of that offer.
All right.
And thank you so much for coming. I really appreciate you all. And thank you for being so patient during that little technological snafu. Thank you.
Hey, it happens. It happens.
Yeah.
So we rocked right through it. So and we could hear you great even after you took your headset off. So
Oh,
all good. All
okay.
good. But to our audience, we did have a question or two, Tiffany. You know, listening to you, Tiffany, it's so important to have proper verbiage, especially when you're integrating technology like a laser. Had a lot of good feedback about some of our laser users that are on the call. But did want to say one thing before I ask a couple of the questions, Tiffany. We will ask to our audience, we will ask Tiffany to provide us, our education department here at BILASE, the same document that she posted in the chat. And we can include that in our follow-up survey that we send to you, the audience. So we'll make sure that you get everything that you need that Tiffany mentioned a second ago through a follow-up email as well. So just wanted to mention that so everybody you know, knows that they will get that document. Now, one of the questions that we had in the chat, I see you answering some of the questions in the Q&A. One of the questions we had in the chat, Tiffany, our biggest obstacle are the insurance companies denying claims. We diagnose SRPs for patients with radiographic calculus tags, and insurance denies due to lack of bone loss. It's maybe a little bit of a review, but what language can we use?
Okay, so the biggest thing is we've got to build our case hygienist. So intraoral images, taking pictures of bleeding areas, doing full perio assessment, and making sure that we're building our case and making sure that our radiographs are showing the clinical attachment loss. And then what we do is we just let them know that the patient is periodontally involved. And here are the things, right? Because we built our case, and we also discussed any risk factors. If the patient has diabetes, if the patient has any systemic issues, then we can lean on that because it affects the oral health. And so a lot of times when we are documenting these claims, we're making sure that we're giving all of the attachments, intraoral pictures, all of that with it, so that way we can get those claims paid. But now more than ever, it is a challenge. I agree. And really working close with your hygiene team to make sure that the front office is getting everything it needs to get those claims paid is a plus.
We had one question that is a little bit more of an elaboration. Could you elaborate a little bit more about the specific, you know, benefits of utilizing the lasers? But I think this participant really wants to understand how it relates to increase in production and profitability. I know there's a lot there, but maybe just highlight how integrating a laser into perio treatment can lead to increased production.
Absolutely. So when we work with our hygiene teams, we generally say, gosh, our 4910 patients, just our 4910 patients, perio maintenance, 75% of perio maintenance patient needs some sort of adjunct therapy on average. So what that means is if 75% of your patients who are suffering from gum disease, right? And you're maintaining them every 3 months, but they're coming in and they're having bleeding and you're seeing active bleeding, active disease. Those are the people where you're picking up that laser to maintain them, right? So there's your profitability. If 75% you're going to use the laser on, then that means that your profits are going to go up definitely. But the biggest thing is the care, right? We're going to be delivering the care. So that's how it equates to profits.
Got it. And I know that you have so much other great content and some of the information you provided and that you can continue to provide, especially in your book. Again, to our audience, we had one question about CE. I'll go over that here in a second. But when we send out an email here in a day or two to get your CE, we will include the information that Tiffany was speaking about in that email. Tiffany, thank you. I'm going to go through just a couple kind of housekeeping notes here for our audience.
Okay.
One of those is when you go to education.biolays.com, that is our education portal that you can go to find out more information about lasers, whether it be all tissue lasers or diode lasers, like we've spoken about this evening. You can simply go to biolays.com and click on education or resources in the toolbar there. And you can click on Epic Academy. The Epic Academy is where our diode resources and our diode courses are. So I know some in our audience already have the laser, but you may have new staff members on board that need training or want to learn more about laser therapies, or you yourself may want to learn more about laser therapies. Go to Epic Diode Academy through education.biolays.com, and you can find all sorts of information there. Some of the courses we have, they're all virtually based courses. Step 1 is a diode fundamentals course. It's a go at your own pace online modular based course. So you can register for that through the website. Step 2 is a live hands-on virtual Zoom training that we have set up both for hygienists. So we have hands-on hygiene diode trainings. We also have surgical trainings for your doctor. So you can go to again, education.biolays.com, view these courses, either sign up for the online modules or sign up for a live course and view the dates through that website. Now, if you want to watch webinars or listen to podcasts, we have all sorts of really cool virtual resources on our website. So for example, tonight we are recording this session. We will edit it and we will put it on our webinar library. So you can watch it again. You can go to other past webinars, or you can sign up for upcoming webinars that we have. Our next one is on October 17th. And that one is going to be titled Dentistry on the Cutting Edge, How AI-Powered Early Diagnosis and Laser Treatment Improves Patient Outcomes. This webinar is in partnership with a really cool company called Pearl AI. Awesome technology. And so we're here at BioLays excited to partner with them on that webinar on October 17th. And then on October 24th, aesthetic patient conditions. So we're going to have Dr. Sam Lau speak on closed aesthetic crown lengthening. Gingival depigmentation and skin resurfacing should be a really cool topic and really cool clinical indications that we can use our all tissue laser called the Waterlays on. So join us on October 24th. And finally, our CE process. You do get one CEU for joining us. You must be officially registered and attendance will be recorded via Zoom. As I've mentioned several times, you will get a survey via email within the next 24 hours or so. If you don't see it in your inbox, check your spam folder. Promise it's there. And that is the survey that you'll fill out. Then you'll get your CE certificate for joining us. But in that email, we'll include what Tiffany was speaking about earlier. And then lastly, if you have any questions for us here at BioLays Education, feel free to email us at education@biolays.com. And with that, Tiffany, again, we really appreciate the wonderful lecture, the wonderful presentation, and the information that you provided to our audience. I think this was really valuable, and we're excited for future partnerships with you. Absolutely. And to our audience, thank you for joining us this evening, and we definitely hope to see you again at a future BioLays webinar. Take care, everyone.
Thank you all so much. Yes, and just email me and I'll answer all your questions. I know I was just trying to get in and answer some, but email me and we'll go deep. Okay.
That sounds great. And you can email Tiffany or you can email us at BioLays Education and we'll connect the dots for you. All right.
You guys are great. Thank you all so much. Appreciate you all.
Thank you. Take care.
Thank you. Bye.